Hey everyone, this is Stephanie Salyer from Africa CDC. So it's 4 o'clock, so we can go ahead and get started. Welcome everyone to our fifth and final One Health and Coronavirus webinar series. I'm excited to be talking about our framework for One Health practice in National Public Health Institutes. And so we're doing this whole session to talking about this framework that have now have finalized and up on our website, and we'll be sharing with all of you after the call. So we have an awesome group of folks that will be speaking today on the various aspects. So I'll go ahead and give everybody a big welcome, introductions, and give you all the coronavirus updates. And then I'm going to pass it over to my other Africa CDC colleagues to talk about the role of National Public Health Institutes in One Health, and a bit of background on National Public Health Institutes in Africa, as well as an overview on the continental One Health capacity and One Health gaps that can be potentially addressed by this framework. And then we're also going to be talking a little bit about, we have a monitoring and evaluation component of the framework, and that's something new that we have not shared with everybody. So we're going to be spending a little time talking about that, as well as a baseline capacity survey that we're going to be sharing with you all and hoping you all fill out so it can inform to help us understand what are the needs around One Health for member states, and really inform the work and how Africa CDC can support you all in the next year. So I'll go ahead and introduce, well, actually before that, and if I don't know if we already had, yep, we're recording, good. So just to introduce, so the framework is out. The website is just below the image that you see on your screen. So please do go ahead and check it out. And we would love feedback and your thoughts on this framework. So today we have a variety of folks talking. Again, this is myself, Stephanie Salyer. I'm a technical advisor to Africa CDC. We have Haftom Tayame, who's a staff epidemiologist here at Africa CDC. He'll be talking about the NPHIs. Yilma Makonnen will be talking a bit about some of the existing One Health capacity across the continent. Athman, our colleague from the Ministry of Health in Kenya, and who also works really closely with the zoonotic disease unit there, will be filling in and talking about how the framework can help meet some of the gaps that Yilma addresses. And then far out, we'll be talking about the One Health scorecard that's included in the framework. And then I'll hand it over to my colleague, Wandi Alimi, to talk a bit about the survey and how we can be informed about how to support member states best in the coming year. And both Wandi and Malian will be serving as our moderators for the moderated discussion. So without further ado, I'll go ahead and give you guys the EPI update for today. And the global coronavirus situation as of 2 p.m. Yesterday per WHO, there are over 42 million confirmed cases and over 1.1 million deaths, with a case fatality rate of 2.7%. And as you can see by the graph on the right, that the vast majority of the most recent cases are being reported from the European region. With regard to the COVID situation in Africa, as of today, there are currently 1.7 million cases being reported from all 55 member states, just over 41,000 deaths with a cumulative case fatality rate of 2.4. And there are just over 1.4 million recoveries that have been reported, and that's about 82% of the total cases that have been reported. With regard to the epi curve that you see on your screen, the vast majority of the most recent cases are coming from the northern region, and you can see that we are starting to see a second grouping of cases being reported. So in the last 24 hours, there have been a total of 11,850 new cases, 201 deaths, and 6,432 new recoveries. You can see over the last week the breakdown by the different regions, And just to highlight that the vast majority of cases are being reported from the southern region. Those most came from the South African outbreak that they had. And then, but most recently, the northern region is reporting the vast majority of the newest cases. If you can look at our graph, our map that's on the screen, still over 23 member states. The vast majority of member states are reporting less than 5,000 cases, and only one member state reported greater than 500,000 cases. If you look at the number of cases being reported by week, you can see that over the last 4 weeks, there's been a 5% average increase in the number of cases that have been reported from Africa. And if you look across the different regions, you can see that the majority of those cases are being reported from the eastern and northern regions, with an average 9% increase for the eastern region and a 6% increase for the northern region. And then this is the breakdown of the number of new cases being reported over the last 7 days by 1 million population. And you can see that the vast majority of member states are reporting, to 27 are reporting between 1 to 10 cases per 1 million population. And so now I'll go ahead and pass it over to my colleague Haftam. And Haftam, feel free to just let me know when you're ready for me to move to the next slide. Thanks so much.
Thank you, Steph. Good morning, good afternoon, everyone. This is Haftam, Principal Technical Officer with the National Public Health Institute and Research Division of Africa, CDC. So in the next few minutes, I will give you an overview of the Africa CDC National Public Health Institute framework, the scorecard, the workforce development, and the activities we are doing, and objectives why this National Public Health Institute division is established. So next. Next, Safe. Okay, thank you. So the National Public Health Institutes, they are national level institutions that are leading and coordinating public health functions. This includes surveillance, emergency preparedness, response, and public health research and workforce development and other public health functions. And according to the International Association of National Public Health Institute, the NPHI is defined as a science-based organization or a network of organizations that provides national leadership and expertise effort to achieve substantive long-term improvement in public health. So the National Public Health Institutes are the drivers of the One Health agenda, because most of the components of the One Health agenda are the functions of the National Public Health Institutes. That's why even this topic came into picture, and even the coordination with the other sectors on behalf of the Ministry of Health is taking the National Public Health Institute. So generally in Africa, there are two modes of a National Public Health Institute, and the most common one is the National Public Health Institute is like a single entity responsible for fundamental public health functions, including surveillance, emergency response, public health research, laboratory information system, and workforce development. So this is the most common and the most advisable, but there are also some countries which have NPHIs with like a network of several government agencies responsible for the various public health functions. So, they could have, an institution which is responsible for laboratory research. The other will be responsible for surveillance, emergency response. Others can be responsible for environmental health. So then they come together and form like a coordinating unit. So this is less common in Africa, but these are the two types of NPHI status in Africa. Next. So why do we need a National Public Health Institute? By the way, this is a big flagship of the Africa CDC, especially the director of Africa CDC. This is one of his priority areas that he wants to establish, because the Africa CDC agenda can only be implemented in member states through the National Public Health Institute, because as you see, Africa CDC is a technical agency of the Union, so you need a technical institution in member states to implement the strategies and plans of the Africa CDC. So why do we need to establish this National Public Health Initiative? One is it increases, the efficiency to ensure that key components of outbreak detection and emergency response are linked, and data flow is real time, and the communication are clear and consistent. And this is done by bringing together similar functions into one organization, and removing redundancy and organizational barriers, and efficiency will be increased. Second reason why we need NPHI is because it increases effectiveness. And this increased effectiveness is by linking the key components of public health, which results in increased effectiveness of all groups, because it's bringing the different functions of the NPHIs, or public health functions, the surveillance, the laboratories, the research. So, and they are under the same leadership. So it also gives or increases effectiveness of the National Public Health Initiative. Thirdly, they also contribute, to the public health workforce and skill building, and because it also creates, or defines a career path, including advancing development of public health system leaders. And finally, this also, or the having an NPHI also provides a coordination mechanism for collaborative projects focused on national priorities and bringing together stakeholders wishing to tackle multiple aspects of public health problems. So these are some of the key points, or the key rationales why we need a national public health initiative in each country, in member states. Next. So what are the key attributes of a good national public health institute? One is it's a science-based. That means it emphasizes on the use of data and evidence to make recommendations, develop programs, and suggest policies in a partnership with the Ministry of Health. Second, the National Public Health Institute, or a National Public Health Institute, has a national scope, meaning it serves the entire national population. It's not only meant for a certain community in a country. Then if its mandate is, or its focus is only to certain community in the country, then this stops being a national public health initiative. Thirdly, the key attributes of a national public health initiative is it's a transparent and accountable, which means it helps to manage and accounts for resource using a good business practice. And it also creates a strong and continuous improvement of the National Public Health Institute workforce, which includes having strategies for individual growth and retention mechanisms, or career paths. A good national public health initiative also creates an adequate infrastructure to perform the core functions of the health system efficiently, which means it gives an infrastructure for laboratory, information technology, for training centers, or in other functions of the National Public Health Institute. The NPHI is also should have also clearly defined legal authority for its work, and this legal framework could be like a legislative decree, proclamation, or acts that bind this document, that binds and defines the mandate, key functions, and authorities of the National Public Health Institute. That's why we advocate and we support toward this establishment of the National Public Health Institute with a legal framework or a legal document. And also this National Public Health Institute gives an opportunity for linking with the international, national, and sub-national levels to ensure the effective implementation of the international health regulations and global health security implementations. And also it links the Ministry of Health with local level public health stakeholders, as well as the Africa CDC's regional collaborating centers and other international partners. And finally, and the National Public Health Institute should have a plan for sustainability, meaning it creates or develops plans for working with the government appropriations and for garnering support from partners, or develops research grants and creating foundations. This is how it gives it devises a mechanism for sustainability of the National Public Health Institute. So these are the key attributes of a National Public Health Institute. Next. So generally, according to the International Association of National Public Health Institutes and the essential public health functions of WHO, the National Public Health Institute has like 11 core functions, which includes public health emergency response, laboratory systems, preparedness, and also health promotion, disease prevention, advocacy for community health, development of health policies and plans for health, and development of workforce and for the health system, and also evaluation of the health system and access to health services, research, and so on. So these are the core function of a National Public Health Institute. But according to Africa CDC, we have set a minimum core functions for an NPHI to be called an NPHI. Next. Yes, so for Africa CDC, we have developed a framework for the development of a national public health institutes. And in this development framework for NPHIs, we set the minimum core functions an NPHI should have. And these are aligned with the core, with the pillars and core functions of the Africa CDC. So an NPHI should have the responsibility of the function for disease surveillance and disease intelligence. It should have a mandate or function for laboratory systems and networks. It should also have an information system and also responsible for emergency preparedness and response. It also needs to have a function for public health research and workforce development. So these are the minimum core functions NPHI should have. So it can have more than this one, as you saw in the previous slide, but these are the minimum core functions that an NPHI should have according to the Africa CDC. Next. So what are the success factors for the creation of a National Public Health Institute? Definitely the first and top factor or priority is having a buy-in and commitment of the top leadership, the Ministry of Health and the country's government leadership. Without securing commitment and buy-in of this Ministry of Health and the top leadership, we cannot take anywhere the establishment or creation of the National Public Health Institute. Secondly, you need to have a skilled and respected leader who will be champion and lead the process of establishment of this National Public Health Institute, who is dedicated most of his or her time for leading, planning, and the management of this process. And also you need a kind of team. It could be a steering committee or a team which a multidisciplinary or a multi-departmental that also works on the development of the National Public Health Institute till the National Public Health Institute get endorsement, legal endorsement. And this team needs to have a shared vision and a strategic plan or a roadmap on how to establish the NPHI, what is the purpose of establishing, what are the goals, the core functions, all these things. So this team should have a kind of shared vision and need to have a roadmap for the development of the national public health issues. So these are some of the key success factors for while you are planning to create a new national public health institute. Next. So the steps while you are developing or when you want to develop the National Public Health Institute. By the way, when I say National Public Health Institute, the naming differs. In some countries they call it CDC, in some countries they call it NPHI. So it's just the same. It just both how you call it, but the functions and the process are the same. So the process or steps for the establishment of the National Public Health Institute, as I tried to mention earlier, the first thing is you need to have the buy-in from the top leadership of the country, especially from the Ministry of Health or the minister. And that is the first thing. Second, you need to establish a national steering group or a multidisciplinary group which leads the process. Thirdly, you need to engage the key stakeholders who have stakes on the public health functions and institute. And with all these relevant stakeholders, you need to define the shared vision or develop a kind of roadmap. Then following this stakeholders engagement, now you need to set the public health priorities, and then you use a sample legal frameworks. Different countries have their own legal frameworks, or even Africa CDC has its own sample legal framework. So using this framework, you need to develop the legal framework and get endorsed by the appropriate body in the country. It could be by the parliament or by the cabinet or by the president. So that means once you get this endorsement, the NPHI will be formalized. And following the establishment or the formalization of the NPHI establishment, developing a strategy plan and costing whatever um, establishing the foundations, operational elements, and financing like secure finance, recruit human resource, secure offices, and all these operational elements of the National Public Health Initiative, and continuously improve the plans as needed. Next. So as of March 2019, this is how it looks, the establishment status of National Public Health Institute in Africa. This is according to the definition of the Africa CDC framework for National Public Health Institute. Many countries claim they have a National Public Health Institute, but the National Public Health do not have the core functions that we mentioned above. So more than 70% of member states in Africa do not have the proper national public health institutes legally established. These national public health institutes are supposed to be autonomous or semi-autonomous, which are legally established by an act of parliament or cabinets or presidential notes. So still we have, this is, by the way, this is as March 2019. There are some countries in the process and in the final stage, but as of that time, this is how it looks, the establishment status. Next. And one of the tools that we developed from Africa CDC, which will help the development and the progress, monitoring of the progress of the National Public Health Institute, is the scorecard. we developed in coordination with our partners, especially IAMFI. We develop a NPHI monitoring scorecard, and the purpose of this scorecard is to assess and measure the progress of the NPHI and identify most urgent needs and track the progress of the NPHI over time. And this assessment tool provides information for Africa CDC and the National Public Health Institute to advocate for more resources to support ongoing development of the institute. So this scorecard assessment can apply at any stage. So for a country that has already established a established national public health initiative, it helps us to identify the most urgent needs and prioritize areas for improvement. But this can also help, for a country that doesn't have NPHI, and what it do or what it does is this guides the NPHI development process, because we assess the core functions and the core capacities of NPHI using the scorecard. So anyone who's looking to this tool will help to a country which is developing NPHI, which functions to include and authorities to include in the legal mandates. Next. So this is a process. It's the process for this COCA assessment is similar to the JEE. For the NPHI will conduct a self-assessment. Then this assessment report is sent to Africa CDC. Africa CDC will assign an independent assessment team and review the report sent by the NPHI. Then after that, this independent assessment team goes to the country and conduct a facilitated in-depth discussion and make some site visit to make sure that the facts and the information given by the self-assessment are real. And the final report, then the final thing is to have a final report which will help to develop the action plan for addressing the gaps. Next. So the scorecard is organized by functions. Each function has indicators, and each indicator scores from 0, from no capacity, to 2, has a full capacity, which is 1 is a partial capacity. And it's also, the scorecard also describes if there is a need for a documentation for each indicator, and which justifies the self-assessment. Next. So this is how it scores. So for each functions, you have a minimum score, average score, and optimal score. And we have also a color scoring. For the minimum, it's red. And for the average, it's yellow. And for the optimum, it's green. And this is how the calculation is done. Next. So this is a sample scoring. We did it in one of the country as a piloting. So this is how we are doing the scoring, both the color scoring and the percentage for the core functions that we established. Next. So the third document to help the strengthening of national public health initiative, the sample legal framework, so that countries can use this document to adopt their own legislative document for establishing the NPHI. So in this, it describes the different levels of the document. It has definitions, establishment, the functions, leadership, control, oversight, and advisory board, effective date, repeal, amendment, or transfer of prior authorities. Many countries have different countries have different kind of outline, but these are the minimum contents that a legislative document for the establishment of an NPHI should capture. Next. Next. If okay, so no, please, previous slide.
Okay, hold on. Sorry, give me
The
one.
workforce, yeah.
Yeah. It was this one
The
here.
next,
Yeah.
yeah, yes. This is the last slide, and so this is what the first one, or the first framework that we developed from Africa CDC. Again, this is in collaboration with our partners, US CDC, and IAFI, and the other potential partners. So we have also, because we mentioned that workforce development is one component and key element of the National Public Health Institute, we have also developed a workforce development framework. And this framework describes the different actions and NPHI needs, or the different actions for advocating at highest government level for epidemiology, laboratory informatics trainings. It also includes actions for promoting accreditation of existing FATP programs, and also includes the actions to be taken, to be considered, to collaborate with schools of public health, and for the development of for the promoting for development new programs for laboratory. We haven't started this one. We have a plan to start this laboratory leadership program in public health informatics. So this document also discuss or describes what are the actions to be considered for all these things, and for the development of the Africa CDC workforce development. So we will be sharing this framework, and they are already on the Africa CDC website, but we can also share this document. So this is the overview of Africa CDC National Public Health Institute in a nutshell. Over to you, Steve. Thank you.
Thank you so much, Haftam. And I think you have a bunch of questions in the chat, so please stay on to answer those. And obviously, we'll be discussing them in more detail a bit later. And this was an extra slide, so you guys will get this when we send these out to you. But I'm going to go ahead and pass it over now to my colleague, Yilma Makonnen. Yilma, are you on the line?
Yes.
Okay,
Thank you,
great.
Steph. My name is Yilma Makonnen. I am seconded from FAO to Africa CDC, currently affiliated with laboratory systems and networks, but also closely work with the Vibrant One Health team within Africa CDC. So I will be brief in my presentation and give you a kind of a flavor of the current continental One Health capacity based upon available information. It is not exhaustive, but I think will give you kind of an overview of what type of One Health capacity present in the continent. Next slide, please. As you all know that One Health addresses complex health threats at animal, human, and ecosystem interface. It also supports global health systems in improving it in a sustainable way, so that it ensures an efficient prevention of global health and other related health threats. Using the tripartite FAO, OIE, WHO, zoonotic disease guides, and its operational tools, countries can build and strengthen their national One Health capacities. Next slide, please. So by One Health capacity, according to the tripartite zoonotic guide, it refers to a number of dimensions and aspects, one of which being the multi-sectoral One Health coordination. It also involves mapping country contexts, planning and preparedness, surveillance and information sharing, investigation and response, joint risk assessment. Or probably my FAO colleagues may be interested in making kind of a presentation during our next webinar, because I know there is a very strong team at the FAO headquarters. Risk communication and workforce development. So for the purpose of this presentation, I will only focus on the multi-sectoral One Health coordination by way of One Health capacity. Next slide, please. So in terms of definition, a multi-sectoral One Health coordination mechanism, as it is often called in the tripartite guideline or zoonotic guide, and also within Africa CDC, MCM for zoonotic disease refers to any formalized standing or group that acts to strengthening or develop collaboration, communication, and coordination across sectors that are responsible for addressing zoonotic disease and other health concerns at the interface, of course. MCMs has routine ongoing functions and is responsible for coordination, leadership, and governance of efforts among relevant sectors to achieve goals that are jointly determined by the various sectors. Next slide. So our focus, as I have indicated, is on the multi-sectoral One Health coordination mechanism. So this helps strengthen and develop collaboration, communication, and coordination across sectors. So this mechanism, MCMs, are also referred by various organizations differently, like for instance, the National One Health platforms, like for instance in Kenya, Zoonotic Disease Unit, IHR Group, One Health Group. So in Africa, CDC and many other international guidelines, this is referred to as a multi-sectoral One Health coordination mechanism, but it also includes these entities. Next slide, please. Now, the multi-sectoral One Health coordination mechanisms either are formal or informal. In countries where they are formal, as highlighted in the brown color on your screen, are fully operational. This includes countries, for instance, in Eastern Central Africa and also Western Africa. And where it is formalized, some of these countries where the MCMs are formal, they have certain levels of decentralization at the subnational or district levels. Now, most of these MCMs are organized in thematic groups like zoonotic disease working groups or AMR working groups, and etc. Informal MCMs also exist in some countries, like for instance in Nigeria, in Southern Africa, or in South Africa, Egypt, Cameroon, and other countries. This, as I told you, the list is not exhaustive, but they have different naming and designations. Next slide, please. For instance, in Egypt, the existing arrangement is referred to as a four-way linking. It involves animal and human health, and from both sectors, it brings together the epidemiologic and virologic teams. And basically, it is meant improving a qualitative risk assessment of highly pathogenic avian influenza, predominantly H5N1 at a national level. So they regularly meet and exchange or share epidemiological and virological information, including sequence data on a highly pathogenic influenza, and sometimes also on other pathogens of interest. And it is narrow in scope because it also involves the human and animal health sectors, but this can serve as a kind of a startup platform where it can be expanded to include other relevant key sectors to become a kind of a full-fledged multi-sectoral One Health coordination mechanism. Next slide, please. Now, just to give you a kind of a recent example related to COVID response, it's an example of One Health in action where veterinary services are involved in some response activities. For instance, in countries like Ghana and Ethiopia, a number of veterinary laboratories, thanks to their existing capacity, were involved directly in COVID testing, of course, after receiving a formal approval from concerned authorities. in the respective countries, and also in COVID-19 sample storage. In countries like Senegal, for instance, the veterinary service were involved in the monitoring of health emergency operations and health protocols for the Ministry of Education, for instance, during the reopening of schools and for some festival activities. They were also involved in joint zoonotic thematic group activities. Interesting, for instance, in Liberia, the community animal health workers and some paraprofessionals from animal health sectors, after receiving, of course, a proper training, were participating in contact tracing of COVID-19 cases. So it's very interesting, and this is a country where there is a limited overall health system capacity deficiency. In Sierra Leone, are basically focusing involved in the preparation of some relevant documents that are used for COVID response. In South Africa, for instance, the Agricultural Research Council supported the National Institute for Communicable Disease with its COVID-19 testing capacity. So these are kind of recent examples where One Health is really translated into effective action supporting the system, the overall national system. Next slide, please. Now, in a nutshell, MCM achievements we can highlight at most formal MCMs are involved in drafting or developing national One Health policies. We're also involved in the development implementation of One Health multi-sectoral action plans. Strategies for prevention and control of priority zoonotic disease and other health, public health threats have been also developed through these platforms, this mechanism. I also know that in some of these countries, the MCMs were also involved in the prioritization of priority zoonotic diseases using the CDC tool. Now, the most important activities undertaken by most of the MCMs in Africa is about refers to the advocacy and sensitization, particularly targeting the policy decision makers in terms of supporting operationalization and institutionalization of One Health, which is badly needed. They held, of course, the thematic working groups are periodically meeting and also sharing information, including epidemiological and laboratory data. They were also involved in coordinating One Health activities, including celebration of international events like, for instance, the World Rabies Day, International One Health Day, Antibiotic Awareness Weekend, etc. The MCMs are also involved in organizing and implementation of joint outbreak investigations, for instance, for Rift Valley fever, a risk assessment and simulation exercise. A recent one, kind of a year or a couple of years ago, a regional simulation exercise for Eastern Africa involving about 10 countries. This is an actual simulation exercise supported by FAO and GIZ for Rift Valley fever. So it's a very successful kind of an example of One Health in action activity undertaken in this part of the world. Next, please. Now, based upon available information and from the limited engagement we have, we consider the following as the limitations or the gaps of the existing MCMs in Africa. In countries where MCMs are present, the level of decentralization is limited. And in other words, decentralization at the subnational or district levels is limited. Only a handful of countries have got this type of arrangement. In some countries, all relevant sectors are not properly represented, including the public health sector in some instances, forestry predominantly, wildlife, crops, environmental health sectors, and etc. There is also a lack of clearly defined MCM milestones and indicators. This is a very kind of a gap which encompasses most of the existing MCMs. Cross-border collaboration is very, very limited or non-existent at all, because most MCMs are only at present focusing within their national boundaries. Now, the Ministry of Health, the surveillance system within the Ministry of Health in most instances is not including or embedding the One Health zoonotic disease surveillance. So this is an important consideration and can be considered as an important gap. Next slide, please. Now, as it has been indicated earlier, the Africa CDC One Health framework is almost finalized, and in a nutshell, it has got several useful provisions. First and foremost, it provides the MCM structure inclusive of the National Public Health Institute, as it is indicated by Haftom earlier. It also urges authorities to commit finance and human resources. It calls for the presence of legal authority or policy framework. It also requires to have operationalized research agenda, guidelines or plans, operationalized strategic plan, action or implementation plans, and also in order to address the cross-border or regional dimension, it requires also legal authority or a policy framework is needed. Or in other words, the policy framework needs to be expanded to include the regional or the cross-border dimension of One Health as well. Next. So, thank you. That's it from my end. Over.
Thank you so much, Neil. And again, please stay on the line. We'll have a bit of discussion a bit later on, and I'm sure that there's a few questions for you in the chat box as well. So now I'm going to hand it over to my colleague Athman Motondo from the Ministry of Health in Kenya to talk a little bit about how the framework the Africa CDC developed is going to address some of the One Health gaps that Yilma highlighted. And Athman, are you on the line? You might be muted if you're if you're speaking.
Okay. Hello, everyone. Yes, my name is Athman Mwatondo. I work for the Ministry of Health in Kenya. I head the zoonotic diseases unit here at the Ministry of Health, which is a collaborative unit with the Ministry of Agriculture, Livestock and Fisheries. So for the next 10 minutes, I'll be speaking about One Health gaps addressed by this framework that is being launched, or rather introduced. So we know that many gaps have been identified through a number of evaluations, which include the joint external evaluation, performance of veterinary services, and many more evaluations that have been done. And this framework comes at a very good time where the One Health movement has actually matured, and many countries have established or are in the process of forming national public health institutes and also One Health platforms. So it comes to address a gap which is now more evident than before. Next, please. So the purpose of this framework, the framework provides minimal objectives and proposes activities with focused guidance. So this is a framework that encourages member states, while not trying to be prescriptive, provides a very firm guidance on how NPHIs and Ministry of Health can do to promote One Health, and specifically to address priority zoonotic diseases. So this will help in operationalization and also institutionalization of the One Health in the member states. Next, please. So the gaps that have been mentioned by my senior colleague, Dr. Yilmaz, one of them was in the coordination and collaboration. So discussion about how the MCMs can help to bridge this gap. We know that we have many coordination gaps. Our organizations from the health and other sectors, there is silo mentality. We have different organizations, cultures and processes, and we have different professional affiliations between the professions that work in these organizations. So what does this framework aim to? It is to support the creation and strengthening of multisectoral One Health coordinating mechanisms, and therefore encourage and NPHIs to engage in formal MCMs. That's what Dr. Irma was mentioning about, through either memorandums of understanding or formal committees, and also ensure that these stakeholders share relevant information towards zoonotic disease prevention and control. And also another important aspect is where NPHI with stakeholders develop and implement priority zoonotic disease list, because we know why the importance of ranking of zoonotic diseases for country specific and also context specific reasons. We need to know where our biggest problems are before we even start to tackle them. Therefore, of course, this framework supports NPHIs to conduct these prioritization exercises, and also develop strategic plans for the various programs that it develops, whether it's disease-specific strategic plans, contingency plans, or One Health strategic plan at large. Next, please. The other gaps that are common are gaps in data sharing. And here, timely dissemination is one of the biggest problems. Here in Kenya, I mean, we have a very good example that at one point we went to a very highlands, sort of high agricultural county. And when we went to the community, we found that there was very little brucellosis in their animals. And then we also went to the hospitals and we realized that brucellosis diagnosis was about 10% of the diagnosis made at that very hospital, supporting the very community that had very low brucellosis in their animals. So we were asking ourselves, how is this possible that the same disease, which we know how it transmits, is very low in the animals, but very high in the humans? So this points to lack of sharing of data. And therefore, this framework comes in to support strengthening or creating new mechanisms for information and data sharing that are relevant to One Health. And this is important because we have these mechanisms that are already existing, like the notification towards IHR for the Ministry of Health people, and then the OI reporting for the Directorate of Veterinary Services sector. And then also we need to develop data sharing protocols between sectors and tools that can speak to each other, which is very important. So collaborating and coordinating is important, but communication and data sharing is paramount to have this One Health mechanisms working. Next, please. And then disease surveillance. So zoonotic disease surveillance, there are many challenges, but key is the uncoordinated zoonotic disease surveillance between the sectors. So relating to my previous example was, you know, the Ministry of Health and the livestock sector will have their own parallel sort of reporting systems, reporting channels, reporting tools, and even the way they define cases and capture data will be very different. So we need to ensure that the existing surveillance system includes priority zoonotic diseases from both ends, that eventually the data that comes from these two systems can even speak to each other. And then now we have most countries, at least in Africa, have the indicator-based surveillance on the IDSR for the human health. And now many more are coming up with event-based surveillance, which this framework promotes the development of this surveillance and strengthening for countries that already have this surveillance. And the framework references existing documents that are there, and you can see we have the Africa CDC surveillance framework, the WHO CDC technical guidelines for integrated surveillance system. There are disease-specific surveillance guidelines that are also referenced in this framework. So they are very useful for NPHIs to and other stakeholders to use to develop and strengthen this surveillance system. Next, please. So this should be my last slide. So we are highlighting the other goals of the framework. I've just gone to quickly over 2 goals, but the other goals that are looking at lab capacity. Therefore, we evaluate our lab capacities and strengthen the networking between labs. Training of laboratory staff. We know lab staff are often left out in most of these plans, so that labs are able to test for a lot of these priority zoonotic diseases. And then countries to conduct joint risk assessments between the sectors to identify priority zoonotic diseases and also events within these countries. And then countries develop national preparedness plans together under the One Health approach, addressing the epidemic-prone zoonotic diseases in their countries. And also get this One Health training opportunities that bring together the various personnel from the sectors to study together, maybe from there promote the One Health approach at the same time. So this framework generally proposes and encourages and gives guidelines to countries and member states in order to address these gaps. And there are many resources that are referenced in this framework. And most of these resources are available online, but also available, I think, at the Africa CDC. So thank you so much for this.
Thank you so much, Ahmed. And I'll go ahead and pass it over to my colleague Farah to talk a little bit about the monitoring One Health scorecard that is associated with the framework. Go ahead.
Hello, good afternoon. This is Farha Abdullah, Africa CDC Public Health Fellow. Today I will be presenting the monitoring of One Health progress. Next slide, please. Stephanie. Just as introduction, Africa CDC has recognized that a One Health approach is necessary to deliver effective and efficient infectious disease surveillance and control, as well as the emergency preparedness and response. Therefore, Africa CDC is committed to ensure NPHI MOH institution evaluation efforts through an interactive process with African Union and Zoonotic Disease in Africa CDC partner. An initial technical working group was convened by Africa CDC to oversee the development of this initial draft, and subsequent revisions has been done. The technical working group also includes experts from Africa CDC, US CDC, Chatham House, and FAO. Next slide, please, Stephanie. The importance of One Health assessment checklist is to measure and track the progress of One Health within the NPHI with regard to Africa CDC 5 strategic pillars, which are surveillance and disease intelligence, information system, laboratory system and network, preparedness and response, and public health research and institute. Also will help to determine the NPHI urgent needs and track the progress have been made over the time. In addition to provide information to Africa CDC and RCC that may help in setting the priority, planning, and needed support. Next slide, please. Hello?
It's up, I think, the One Health assessment checklist.
Here,
is
yeah.
up.
Okay.
Okay.
Here we will, yeah, okay. Yeah, now I see it here. Here we will define the One Health assessment. It is an evaluation tool developed to help the member states with existing NPHI or Ministry of Health in Africa who are interested in developing One Health capacity to assist and measure the progress in reaching the framework's five goals, which are strengthening their multi-sector One Health coordination and collaboration approach, and develop and strengthen the surveillance system, effective and coordinating emergency preparedness and response. Also strengthen the lab capacity and strengthen and support the workforce development. This tool can be used directly by the NPHI to conduct an internal assessment or external group of an independent evaluation is needed. Next slide, please. Here we will explain how this scorecard is aligned with NPHI scorecard. Most of this NPHI scorecard, it has been explained area by Dr. Hafton. So this scorecard is built on existing NPHI scorecard, and all the indicators align with the NPHI scorecard. As this One Health scorecard also includes all the 10 NPHI core functions, and also it could include 20 indicators out of 68 NPHI indicator. If you ask me why it is only 20 out of 68, because it will be just evaluate the existing of the One Health approach within the NPHI or Ministry of Health, and not the whole NPHI function. Next slide, please. Here we will see how the scoring will be. If the NPHI have no capacity in One Health, the score will be 0. If the NPHI have some capacity and meet some of One Health in One Health capacity, we will score it as 1. If the NPHI have complete capacity, as it is mentioned in the indicator, we will score it 2. So the scoring will be from 0 to 2 for all the indicators. At the first time is scorecard. If we are doing the scorecard for the first time, it will be established a baseline measurement of the NPHI on One Health capacity and capabilities. The results from implementing the scorecard will be used to inform the NPHI development and strengthening. Next slide, please. Here we will explain the One Health function need to be assessed by the One Health assessment tool. Please note the scoring for all the indicators as mentioned in the previous slide. It will be from 0 to 2. The first function will be the structure, and here we will assess if the NPHI have multi-sector One Health coordination mechanism in place with the other sector or not. For the second function, the finance, here we will assess if the NPHI have the decision-making authority to commit financial and human resources it's good also to mention most of these components. It has been mentioned in the all previous presentations. Third is legislation. Here we will assess if the NPHI have policy or authority or policy framework in place with all other relevant sectors. For the following function, public health research and institute, here we will see if the NPHI, they have overalization research agenda inclusive of One Health and priority zoonotic disease in place. For the next function, the strategic plan, here we will see if the NPHI or the Ministry of Health have in place a strategic plan inclusive of zoonotic disease or One Health and other parts, For the information system, here we will look for the NPHI if they have coordinated surveillance data sharing policy framework indicator, but this is example of you can access the all set of the indicator in the framework. This is just examples for each function. For the surveillance and disease intelligence, here we will assess if the NPHI have function indicator or event-based surveillance in place. For the laboratory system and network, here we will see if the member state or the NPHI have capacity to test the 5 priority zoonotic disease and the lab, and if there is lab information management system in place. For the preparedness and response function, here we will assess if the NPHI have done joint risk assessment with all relevant sectors or not. For the latter, we will assess if the NPHI have field epidemiology training program, training core pillars. Okay.
I think we lost you for a minute.
Do you hear me in the last slide?
Yeah, we can.
Hello?
Yeah, I heard you. I think I didn't hear you on the last point, which was the workforce development. Go ahead.
Okay, for the workforce development function, here we will assess if the NPHI have field epidemiology training program in the place inclusive of One Health and zoonotic disease. Okay, over to you, Stephanie. Thanks so much.
Thank you so much, Farah. And I have my name on here. I should actually have switched it over to Wandi. So I'm going to pass it over to Wandi Alimi to talk a little bit about this baseline capacity survey that we developed so that we can have a better understanding of the current capacity that member states have with regard to One Health. So Wandi, I'll go ahead and pass it over to you.
Fantastic, thank you. So we've heard a lot about the work that we are doing at Africa CDC, looking at the National Public Health Institute and looking at how our multi-sectorial team is aiming to support member states on improving and operationalizing One Health. One thing that we are committed to doing at Africa CDC is ensuring that whatever gaps that we are filling, whatever capacity that we are strengthening is identified by our member states. So our goal is really to support and strengthen the needs, the priority areas that member states have identified. So as such, the purpose of this baseline assessment or capacity survey, like my colleague Stephanie has said, is for us to gain a better understanding of what the current capacity, One Health capacity is across across the continent. We have some pocket of data, but we know that there's no one else better to tell us than member states who are on this call and representatives of NPHI that we work with. This is also to help us as Africa CDC to inform our plans for the activities that we'll be supporting across the member states and across the region, the regional collaborating centers. Finally, we really want this survey to inform the key gaps that we can support as Africa CDC. And the chart, I have just put the link to that survey. What we really want is to get some feedback. It's available in English for my English-speaking colleagues on the call, and in French for my Francophone colleagues on the call. We encourage you to complete that survey and provide us with responses by 15th of November. It's a good time for us to get back to you, share and the data that we have put together so that we are sure that it's the needs that countries are currently facing that we are addressing. So please, we encourage you to fill in that survey and also share with your colleagues across NPHIs, across the One Health platforms, across the MCMs available in your country. And for partners on the call, please kindly also share this with your country offices, with the colleagues that we're working together with. Next slide, Steph. Fantastic. So thank you very much. That's for the baseline survey. I think we would have enough time. Myself and Malion, my colleague on the call, will take your questions. I know some of the questions are already being answered by our colleagues after. So please feel free to drop more questions on the Q&A function, and we will take the questions. So over to you, Malian, if you want to just read out the question that is on the Q&A chat box, and we can try to address it. I think it will probably be Yuma to address it. It's a lab-related question.
Thank you, Wande. Good evening, good afternoon, and wherever you are. One of the participants is asking, as we all know, there are many assessment approaches for laboratory capacity. How the One Health laboratory assessment is integrated with other assessment approaches, for instance, with WHO lab assessment mechanism. I think this goes to Yilma. Over to you, Yilma.
Well, I'm not a lab expert, but I know there are a lot of laboratory capacity assessment approach, for instance, in FAO, I think OIE. So it's just, the only thing that I can say at this stage is we need to really harmonize the various assessment tools available to us, and I think it is doable. It's about bringing people and understanding the value of coming together and have an harmonized kind of approach. So you are right. So Africa CDC's assessment tool, I think, laboratory assessment tool took, sometimes it is always advantageous to come late. So I think was able to capture some of the key elements embedded in various, institutions, assessment tools. So, but you are right. There are different institutions are developing their own assessment tools. So it's up to us as One Health, to promote and harmonized type of approach in developing our tools and also implementing. At the end of the day, these are going back to the member states and addressing the same people. So for the time, this is only the comment that I can provide. Over to you.
Thank you. I think I might just be able to add on a bit as per the AMR aspect. So one of the things that we are trying to strengthen as Africa CDC in collaboration with ASLM, Fleming Fund, and WHO, FAO, and OIE is EQA, external quality assessment. And because we are really committed in terms of strengthening the One Health approach, one thing that we are doing now with a number of countries, at the moment 14 countries, is to ensure that the national reference labs for public health and veterinary labs or environmental labs are going through this EQA process, and we have mapped out sort of centers of excellence that we can encourage some sort of twinning activities whereby we can exchange best practices and lessons learned from one lab to the other across countries, within countries, and across regions. So just to add on to what Yuma said about assessment tools, we are very much in line with that. So
thank you, Dr. Yewande. We have another question from Victor, and this goes to Haftom. He's asking, the speaker mentioned about NPHIs having increased effectiveness and efficiency. Is it possible to share any evidence, if any? Over to you, Haftom.
Thank you, Marion. I cannot present a documented kind of evidence, but the way the NPHIs are structured, because they are bringing together so many activities or functions at the same time. Now they are using the same kind of resource. For example, if there were like 3 different functions in 3 different institutions, that means each institution, for example, the disease surveillance and response needs to have its own lab, and the research needs to have its own lab, and our environmental health needs to have its own lab. But what if these organizations are coming together and they are established under one structure, under one institution, that means they are using the same kind of resources. You don't have to develop a laboratory capacity for research separately, for disease detection or surveillance separately, and for environmental health separately. You are using the same kind of infrastructure because you are under the same kind of the same management and the same institution. So you are efficiently using your resources. One, this is in terms of resources. Second thing, in terms of time, if we see, if this is different, for example, the surveillance component is under one department somewhere, and the laboratory is under another in somewhere, and the research in somewhere. That means you need to communicate, and it takes time even to get a service while the surveillance is requesting a service from the laboratory is giving the result of the surveillance, then the response. So it just avoids all these time delays because you are in the same premise or under the same structure, under the same leadership. So you are just cutting these time delays, and the result the same. You, in order to inform a result, you need an approval from your leadership. If you are in different institutions, because the data is sometimes sensitive, then you have to ask it formally, then it delays even your reason. But once you are under the same institution, you don't have to look for hierarchical requests to get your results or to respond to your emergency. So you are getting the services in the same premise or in the same structure so that you can quickly respond to that one. So this is how it increases the efficiency of the institution for public health service, especially when it comes to emergency response. If you don't have the laboratory in the same structure or management or institution, and your emergency response is somewhere, surveillance is somewhere, then the outbreak will go beyond your capacity. But if they are together under one leadership, this avoids all these kind of effects or unnecessary effects. So this is how it increases the efficiency. Of course, I cannot present a kind of study or something like that, but it's very clear. So this is how we are thinking the efficiency will increase. So that's it, Malone. Over to you.
Thank you so much, Haftom. Another question also goes to you. In your experience, which model works better for African countries? An NPHI that is governed by a Ministry of Health administration, or one that is same autonomous body with independent structure, but reporting to the Ministry of Health? Over to you, Hafton.
Yes, thank you again. So we are advocating for autonomous national public health institute, if not semi-autonomous, because one, this NPHI, if it's autonomous, it can deal with independently with stakeholders, with partners, and it will have its own resources, sustainable, because it doesn't depend on the willingness of the minister. If it's under the Ministry of Health, then when the new minister comes and that minister is not happy about whatever this division or department, they may change it. So it's one issue is about its sustainability. So if it is autonomous or semi-autonomous, which is with a legal mandate, endorsed by the legal institution of the country, so it will be sustainable, it will have its own resources, it will have its technical independence on scientific independence. So we promote these institutions to be semi-autonomous, but they have a working relationship with the Ministry of Health. Of course, they report to the Ministry of Health, but the directors or the CEOs of these NPHIs are not assigned by the Ministry of Health, and their plans are approved by the parliament or not by the minister, so that it gives them more of technical freedom and more sustainability, and they can quickly respond, and they can easily mobilize even resources from partners, and by developing different funding mechanisms or grants and so on. So most common in Africa is a single entity, which is autonomous or semi-autonomous. But the networks, it's a bit challenging, but for countries which have already established institutions, you cannot, it's very difficult or challenging to disrupt the existing system and create a new, or bringing them under one roof. For example, taking Kenya, they have a well-known institution, KEMRI, which is a research institute. So you cannot resolve that one. Rather, what he can do is KEMRI and other institutions, they can have their independence, their authorities, their governance structure, but having a coordinating unit so that they can coordinate the efforts of the different institutions. But for NPHIs which are in the process of, or which do not have any one at the moment, we go for the single institution. Over to you.
Thank you so much, Hafton. And I'll hand this question over to you, Dr. Yewande from Washington. One problem that the US CDC found after the fact was that needed these skills before an event happened. In other words, Africa CDC may not know what the needs are until it's too late. I highly recommend being proactive and see what other skills are needed instead of looking internally. Over to you, Yewande.
Thank you for that very interesting question. And thank you for sharing your experience from the United States. This is very welcome. For us, what we really do, like I mentioned earlier, is we are really committed to working with our countries to identify what the countries need. So ideally, we know that countries, Africa is quite heterogeneous in terms of a lot of things, economies, disease prevalence and burdens. So ideally, we rely on our countries to identify what gaps and what needs are, and as Africa CDC, we strengthen them such that it's a sustainable and country-driven capacity building. So those are really our priorities, to ensure that whatever workforce development programs are available across the member states, they are country-driven, country-owned, and very sustainable. I think it's really welcome that you say that we should start thinking about skills ahead. One of the things that our workforce group is doing is also looking at that, ensuring that we have a wide or diverse skill set in the workforce pool that we have, that also supports our member states. So thank you very much for that input. Over to you, Marion, if there are any other questions, or otherwise we can hand over to Steph.
Thank you so much, Dr. Yewande. And I do not see more of the questions. I can hand over to you, Steph. Thank you.
Okay, thank you so much, Melian and Wendy. Thank you so much to all of our speakers today on the call and to all those who attended. We look forward to hearing feedback regarding the framework that's out now, and seeing how you all are planning to use it, as well as hearing feedback from you on what the perceived gaps are, so that we can try to better support those in the years going forward. So thank you again to everybody. And big reminder, International One Health Day is next Tuesday, the 3rd, November 3rd. So please do keep that in mind. And I hope you guys are all celebrating that day with your One Health colleagues. So thank you again. And we look forward to speaking with you all over the next few months and in the coming year with regard to your One Health work across the continent. Bye, everyone.
Bye.
Thank you. Bye-bye.
Bye, thank you.